You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network. Welcome to the McKesson IdeaShare 2025 post show, where we bring you the showroom floor conversations from the changemakers in the pharmacy profession. This year's event was nothing short of spectacular, and in case you missed it, this is your opportunity to catch up on what went on in Nashville at the McKesson IdeaShare conference. Join our host, Todd Eury, CEO and founder of the Pharmacy Podcast Network, for this exclusive coverage of the show.
Have you heard of iCare Plus here at the IPC Independent Pharmacy Cooperative booth? We're here with Ashton, Maraba. It's great to see you. And like I said, I don't think you've been on for a while, so it's good to have you back.
Yeah, I usually look forward to the show. Thanks, Todd. It's great to be back. It's been pretty busy for us the last couple days, and I appreciate that we took the time to sit down and talk and maybe talk shop before the actual session. And It's always a good time connecting with you.
Well, thanks
for having me back.
All right, iCare Plus, just to bring everybody up to date, we have you've spent a tremendous time staging a system that's empowering our pharmacy owners, pharmacists to dig down into clinical, get paid for things, track things, telehealth, remote patient monitoring. Like, you've come a long way. So bring us up to date with iCare Plus.
Just the way you phrased it, I'm a pretty emotional guy. People that know me, I like to lead with passion and optimism. I think that's really important and being positive. But when you think about how you phrase that almost brings tears to my eyes. I'll be honest with you. I wear my emotions on my sleeve sometimes. Most of the time I like to contain them, but it has been a heck of a ride. We have such a great team, and I think I prefaced that yesterday during our annual reception. Diverse, built for the future. Certainly, we're open to scale, and we're gonna need to do that. It's been an amazing ride. The early days when you're building a program like iCare Plus and the whole digital health ecosystem, you have to consider a lot of factors. You're gonna face your obstacles. You're going to face your challenges. You're going to have to be an operator, a salesman, an engineer. A guru at some point. You're going to have to be a team psychologist. You're going to need a psychologist at some point, and everything else that goes along with it. We set ourselves out on a journey to focus on 5 pillars of digital health, and I'm not going to get into each pillar right now. I mean, there's just so many qualified team members that can talk to anyone about our 5 pillars at any given point. What I am going to say is that our mission was to fulfill growth each year and not just get on stage and talk the talk. Mm-hmm. We really have to walk the walk, and that's what differentiates IPC Digital Health, all of our business units from, I think, the rest of, for the competition that is out there. Talking the talk and walking the walk with us meant leveraging all of our resources, leveraging our intellect, our strategic mindset, listening to members out there, understanding what their constraints are, but also being bold, being brave, and being truthful and transparent to be able to have frank conversations and try to convince them that, testing the waters is critical if you're going to transcend yourself to modernized care and modernized delivery services. And here's what we're working on. There's going to be a phase 1, which we call iCare Plus phase 1, which is the telehealth strategy itself. Telehealth is a very broad category. Mm-hmm. And so what we've done is we've kind of narrowed the focus on what makes sense. There's a cash side and there's an insurance side. We've always said that when we build this, the goal is to build a virtual healthcare network, and quote unquote network. The network is critical from the payer perspective. And I think, Todd, one of the things that you realize, and I think that's been, we've created a lot of noise with the last few days, was the release of our Clover Health partnership press release.
Yep.
We said that was part of our business plan, our business model. And in 2025, it was aimed at gaining one payer that supports our members that have launched iCare Plus. I love this industry. I've been in it for 25 years. And I've seen all the ups and the downs. When I came in and broke into the industry, it was just riding high. I mean, the reimbursements were through the roof. Didn't really have a PBM issue back then. And I can't believe I'm at the point in my life where I'm actually saying back then.
Yeah.
But we're at the point where we were able to monetize our strategy and proof points and build the evidence that validates a cash-based part of our telemedicine, telehealth strategy, and then also recently commercialized our remote patient monitoring strategy that focuses on one disease state with the option to get into chronic care management, which focuses on multiple disease state, all monitored and managed through our platform. The progression in 1 year has been extraordinary. I got to be honest with you, I don't think very many companies out there, and I hate to kind of, speak for the rest of the industry, but what we've done with an EMR and reverse customized it without getting too techy, what we've done for independent pharmacists by making a platform pharmacist-centric. You have to be bold and brave to get into something like this because, and you have to really believe it's going to work. Even when you experience setbacks in different parts, of what you're building, or you're early on in the phase and you get a little bit of feedback or testimonials that may not be as great as you like. But as you progress and you start to realize that, hey, we're getting more 5-star feedback than we've ever received. And this month, it's becoming a trend. That's pretty cool. What's important is not to dwell on what doesn't work and enjoy the wins, and then take feedback and utilize it constructively when you're building a program. So where we are today is that we have advanced the most powerful pharmacist-centric ecosystem of digital health solutions and tools for our members that doesn't exist today anywhere else. We've combined traditional telemedicine with a pharmacy-centric telepharmacy light approach and a phase 1 strategy. We've evolved an iCare Plus Script Pass, which is its own, our own signature cash card that has reimbursement built into it for our pharmacists. We have integrations with Uber Direct for medication delivery and Uber Health for people transport. We've had some great stories come from our iCare Plus pharmacies that have lost a delivery driver recently, and look, if we didn't have the integration with Uber medication delivery and the price points that were negotiated that are competitive in the industry based on our integration, they would have had some serious issues and backlog. So we are working currently on a full partnership pilot or opportunity with Best Buy Health. We're also working on a partnership with Quest Diagnostics to further integrate an existing partnership with them in order to adopt at-home test kits powered by Quest Diagnostics. We're also going to adopt at-home phlebotomy testing. So we changed our home test kit strategy from earlier this year, in 2024 actually, going to 2025. We realized that we didn't want to impose additional burdens on the pharmacists, on the staff with the home test kit category, and we found that a direct-to-patient delivery made more sense, but giving the pharmacist the opportunity to suggest it, and then obviously marketing within iCare Plus that option and integrating with the lab themselves made more sense. But secondary to that, the opportunity to add new tests like colorectal screening, very important, the accuracy of their testing strategy, and the fact that Quest is one of the largest lab destinations in the country. Most of the communities in the U.S. have access to Quest Diagnostics, but also we're going to be leveraging their at-home phlebotomy testing and building a menu in our iCare Plus ecosystem for patients to purchase the types of tests that they're looking for, and then obviously the phlebotomist go there as well. But most importantly, part of iCare Plus that has evolved and where we've progressed is also in the compounding world. We are building by leveraging our our outstanding pharmacy services and clinical services team and special programs team that falls under pharmacy. I also oversee pharmacy, so it was a benefit to combine digital and pharmacy together. Everyone's working fabulously. It's a great collaboration between all the teams involved. We are going to launch a specialty compounding formulary. We're in the process of building one out with the support of Olympia Pharmaceuticals.
Okay.
And we are going to leverage our iCare Plus telemedicine doctors under our good actor, best-in-class, gold standard approach that we are obligating ourselves to and to our members. And we're looking forward to that as well. So there is a tremendous amount of stuff going on, Todd. And when you ask me one question, man, I just keep going and going. So
this is wonderful. What a great update. What an empowering, exciting update. I knew the progression of iCare Plus was going to start picking up some speed, and it definitely has.
Yeah, and you get to a point where, we do a lot of reflection. We listen to a lot of our members. But it's really important to, and I can't thank our team enough for just believing in what we're doing. I mean, even one of the reasons why I had Journey, Don't Stop Believing on when I came out on stage yesterday, because it's true. You just can never stop believing when you're building something that you truly cherish and are impassioned with. Especially it's not just for you. You're not building it for you. You're building it for your customers, and you're building it for their patients, and you're building it for the community. You're leaving a lasting taste in the mouths of the people that are looking for change and innovation in modern day healthcare. We're not just adopting tools just to throw it out there and hoping that it sticks, and then you never know what it can happen, and you just throw stuff out there. Sometimes it's like think about products in a CPG aisle that end up in a discount bin at a Walmart. At some point, we've all kind of been through there, and we've seen the products that we've represented, and we're like, once you hit that dreadful discount bin, forget about it. And not that I'm calling anything out, but our goal is that that's our catalyst. That's our fear, to stay away from that, and make sure that we're constantly correcting and making the changes and dealing with the feedback that comes back. But I'll tell you what I'm really proud of these days, because I think that's really important for everybody to understand. I'm proud of the staff that we've amassed that really, and one thing we talk a lot about is drinking the Kool-Aid. I'm proud of how IPC as a company has embraced our strategy. I'm proud of the fact that we're in a position where not only have we've defined modern healthcare, but we've shown the proof of what it really means from a simplistic standpoint. I'm proud of how our IT team has worked with us to create and further embed digital, because we talk about digital out there, but we never really talk about digital inside. In order for us to establish member dashboards and the data and really kind of transition that data into meaningful use from our world, there's also a second world of digital that's getting built. So you're talking about all the work and effort that we do, that you see on the product and what you see out there, but you just can't imagine the amount of work and effort that we put in forth, internally, and then get ready for a show, and then get ready to talk to customers on the floor. It's a balancing act, and the only people that are capable of getting that accomplished are the brightest of professionals. Right? The people that you're ready to go to war with, the people that you go to battle with, and that you take a bullet for. I'll be honest with you. I'm just telling you, and you've known me long enough to know that. Pretty transparent. And so I think we all feel that way about each other.
That's awesome.
So when we represent digital or pharmacy services or government affairs or purchasing or pharmacy select, and I don't want to miss any of the other great programs we have, or we're talking about the teams that are on the contracting side, or the account managers, or the member services folks, the accounting teams. I mean, everyone really works together, especially the fact that, remember, at the end of the day, we're a co-op. So everything that's earned in digital gets passed back and rebated back. So trying to develop that infrastructure, how do you take this digital world and actually create a rebate around it and get creative?
Right.
Because we're focusing on drug rebates all these years. Yeah. So imagine the acceptance that has to happen within your culture.
Yep.
So when we talk about transforming the way, people forget that transforming the way also meant internally, not just externally. It's not just noise we create. So that's what I really appreciate. And that's what I go to bed at night feeling really happy about, wake up in the morning ready to tackle those Teams calls and hit these conferences running and just embrace the team. I think it's really important. So, when a new member buys into or affiliates with IPC, you're affiliating with the team first. Mm-hmm. That's what you're getting. You're getting a hell of a team, and then comes the products, then comes the contracts, and that's really important in this day and age. I've been in this industry for 25 years. Mm-hmm. I've seen some great vendors, and I've seen some ones that shouldn't be coming to conferences. Yeah. I've seen some great opportunities. I've seen those that, I've seen a lot of everything, and I think we've created that stability and that sustainability that members look for and their patients look for, and partners. Yep. Partners that have a strong value system like we do.
Ashton, this has been wonderful to catch up with you. Excited to be a repeating part of your media and PR team and getting messaging out and connecting people. And I really appreciate you being part of the show.
Thanks, Todd.
Up next, we have U.S. Representative Buddy Carter of Georgia State Congress.
Hey, this is becoming a celebration, and it's the sixth time that Congressman Buddy Carter is on the Pharmacy Podcast Network, and I am so thrilled to have you here in the IPC booth at the McKesson IdeaShare. Buddy, thank you so much for being here.
Well, thank you for having me. It's always a pleasure.
All right, and Mark Asenza is here with me as well, CEO of IPC. This is wonderful to have you guys together.
It certainly is, and thank you very much for the generosity of your time, Congressman, to be here with us in Nashville.
Sure, thank you.
All right, the elephant in the room. I'm going to kick this over to Mark. We're excited about a bill that's been, dropped 24 hours ago?
That's right. We're all excited to hear about the new bill that's just coming out on PBM reform, and perhaps, Congressman, you can lead us into what is this going to mean, and what are the next steps after the parliamentarian kind of did to the bill, big beautiful bill that we're excited to hear about what we're going to go on now.
Well, first of all, it is important that we review where we're at and how we got here. We've been working on PBM legislation for years. There's no question about that. But more specifically, back in December, we had what's called a continuing resolution, a CR, where we just continue our appropriations for the year. And included in that, we had a component of it was PBM reform, and there were actually 4 bills as part of that. One of the bills was the Drug Price Transparency and Medicaid Act, which would have saved $3 billion. And of course, what that did was to eliminate spread pricing in Medicaid. Another one was to Protecting Patients Against PBM Abuses Act, and that really just delinked the price of the drug from PBMs. Instead of getting paid a percentage, would only get a flat fee. Now that in itself would, CBO, the Congressional Budget Office who scores these things, said that it would save $500 million. I personally think it would have saved a lot more than that, but the way they score it, they said it would save $500 million. We all know that that's where they're making the money, through the spread pricing and through the discounts that they're getting. It also had the PBM Accountability Act in it, and that was another big savings of about $3 billion. And that would have called for transparency to the employers and to the plan sponsors. And the idea behind that is that the plan sponsors and the employees, once they saw it, then they would be able to demand from the insurance companies, PBM, same thing, that, hey, you got to share with that. You got to share that with us or share it with our employees. Yep. And that's the way you would have got that savings. And the last one was the No PBMs Act, which this would give CMS the ability to look at contracts and demand that they be fair and reasonable. And that was important as well. Now, we had all 4 of those in the CR back in December that we passed, and at the last minute, and when I do say the last minute, I mean the last minute, I think it was within 10 hours of when it was to be voted on, it blew up. And we were just very disappointed. In fact, we were devastated. It blew up. At that time, some people, specifically Elon Musk, had said, hey, this is too big for a CR. You need to cut it down. And this, unfortunately, was part of what they cut down. So then we came up with the next opportunity, and that was in the One Big Beautiful Bill Act. We couldn't, and you got to keep in mind, in that budget reconciliation is what it's called. In that process, it has to have a budgetary impact. It's got to either save money, and if you can't just let it have an impact on policy. It's got to have an impact on the budget. So we had 2 parts of it in there. We had the drug price transparency, and then we had the Protecting Patients Against PBM Abuses Act. We had that in the reconciliation, the One Big Beautiful Bill Act. And unfortunately, what happens over in the Senate is that the Senate parliamentarian, a very powerful position, by the way, she had to decide whether it was appropriate for the reconciliation bill. She decided against both of those. So then we ended up with nothing. So what have we done now? Now we're introducing the PBM Reform Act of 2025, which includes all 4 of the original bills that were in the CR, in which we have a commitment from the Democrats and from the other people. And this is bipartisan. We have a commitment from them that they're going to support it. In fact, if you look at the sponsors of this bill, of the PBM Reform Act of 2025, you'll see there are just as many Republicans as there are Democrats.
Yeah.
You know, I tell people all the time, I never went to the counter when I was practicing pharmacy and asked someone, are you a Republican or a Democrat? All I knew was it was expensive.
Yep.
And so this is truly a bipartisan issue that I will tell you that I really think we're going to get it across the finish line this time. And I hope that it will be before the end of the year. And it can pass as a standalone bill. We've got that much momentum built up. Mm-hmm. We've got that much momentum built up in Congress right now and in the Senate as well.
That's excellent, and thank you very much. And a lot of people know who are sophisticated listeners of the Pharmacy Podcast Network that you're a pharmacist as well. And
I'm still a pharmacist.
And you're still a pharmacist.
I have my license. I'm not giving it up for this gig.
Well, that's right. and as such, there's the running joke you're the original pharmacist, or I know there's another one out there that I won't say. I'll let you say. But the fact of the matter is that you being a pharmacist and being an advocate for independent pharmacy, to making sure that the nation's healthcare access is available to everybody. We want to help you along that journey. You're our largest advocate and certainly the champion of all this reform that's going on in Washington, D.C. What is it that our members at IPC and independent pharmacies, as we're a cooperative, we want independent pharmacy everywhere as part of our mission to be successful. What is it that we can do to help you, to help us?
Great question, easy answer. Advocacy. Look, ours is a citizen legislature. Congress is a citizen legislature. We got 2 pharmacists. Now, Diana Harshbarger, who's doing a great job. I used to be the only pharmacist. Now I'm just the oldest pharmacist.
Yeah.
But Diana is with us now. We've got 2 urologists. We've got farmers. We've got bankers. We've got accountants. We've got way too many lawyers. But it is truly a citizen legislature, and therefore they need to be educated. You know, when I started 10.5 years ago, when I first went to Congress, I'd say PBM, and they'd look at me like I had a third eye. They didn't know what PBM meant. But they do now, and I'm glad to take all the credit for that. If y'all want me to, you can just
absolutely
just laud me with the accolades. But the truth is that it has been the pharmacists. It has been the grassroots effort of pharmacists going to their legislators, going to their congresspeople, going to their senators and their representatives, and educating them about this and telling them. I'm not exaggerating when I say that almost every day I have a member of Congress come up to me and say, hey, I didn't know you were a pharmacist. I had a pharmacist in my store, in my office the other day, who said, you've got a letter I need to sign on to, so I'm going to have my staff call your staff. That's what's made the difference, educating members of Congress.
Yeah. Well, thank you for that, and it's been a great journey. I guess my next question is that as we move forward, and let's take that PBM reform is going to come, and we're going to get this passed, and now we've stabilized independent pharmacy from a reimbursement and a financial status where we can actually thrive and be part of the communities. What is the next step in your mind that perhaps community pharmacies can play in the overall healthcare system, being kind of the most common access and easiest access for patients in America to have their first foray into the healthcare system?
Well, you just used a magic word, access. You know, I would submit to you that regardless of whether you're a Republican, a Democrat, or independent, that we all want the same thing when it comes to health care. We want accessible, affordable, quality health care. That's what Republicans, Democrats, everybody, accessible. Now let's talk about accessibility. Pharmacists are the most accessible healthcare professionals in America. 90% of all Americans live within 5 miles of a pharmacy. Now, if we continue to see independent retail pharmacies in rural areas close, if we continue to see the major chains closing down stores, you're impacting the access to health care in America. We can ill afford to let that happen. We've got to have pharmacists, and they've got to continue to survive. Or we're going to see definitely a decrease in the accessibility to health care. Not only that, but when you talk about health care, if we're ever going to get health care costs under control, and right now it is the fastest growing part of our budget, and the reason for that is an aging population. We've got a population in America that is aging right now. So healthcare costs are rising. If we're ever going to get that under control, we've got to utilize all facets of healthcare to the top of their ability and to the top of their license, including pharmacists. That's why we need ECAPs. That's why we need pharmacists to be reimbursed for the counseling, for the services that they are providing. I have to tell you that I am so proud of our profession. The way that we stepped up during the pandemic. I just had the biggest smile on my face whenever I'd hear about pharmacists counseling patients, about pharmacists providing them vaccines. Right now, most people are getting their vaccines at a pharmacy. It makes me so proud. I would submit to you that the pharmacists who are graduating today and who have graduated in recent years are so clinically superior to when my classes were coming in, when I graduated. I mean, it's just a different profession now. And we need to be reimbursed for that because we are improving healthcare in America. But no matter what part of allied health it is, we need to make sure that we are letting them practice to the top of their license so that we can decrease healthcare costs in America. Hey, I get it. Doctors are still the quarterback. They're still the captain of the team. But they need help, and we can provide that help.
And certainly that's the philosophy we have here at IPC is we have a lot of innovative things in here sitting in our booth as we speak. Of different ways to engage patient populations for new ways to have revenue and new ways to affect patient outcomes, whether it's remote patient monitoring, some of our teledoc services, things to be able to bring community pharmacy as the center on the first access point in the healthcare continuum. I guess my last question I have for you is, being the CEO of a large cooperative, I get to talk to independent pharmacies every day. And I get to hear a lot of stories about 6th and 7th generation pharmacies or multi-store pharmacies that are having to close or having the financial difficulties of which you're a champion of getting PBM reform. What's your message of hope for those independents now that we're going forward? We have obviously the vehicle that you've now introduced. What is your message of hope for those pharmacists that are out there who are just struggling to get by, but are now looking at the horizon as to where we can be either at the top of our license and the things you just discussed?
Well, I would submit that the future of the profession is bright. And that we have a lot to look forward to. I think that pharmacies and pharmacists specifically are going to play an important role in healthcare in the future. If you look at what Secretary Bobby Kennedy with HHS is proposing, he is proposing that what we wanted to do is to have people live healthier and longer lives. And pharmacists are going to play an important role in that perspective. I know it's tough out there. Listen, I own my own business for 32 years, and I can tell you, I know firsthand how tough it is. I hope you can hang on because there is relief on the way. We are going to have major changes in healthcare in our country, and pharmacists are going to be a big part of that. And, I was chair of the Health Subcommittee on Energy Commerce while we crafted the reconciliation package, and I'm no longer chair, but I'm still on the committee, on the subcommittee, on the committee, and still play an active role in that. But at the same time, the profession, the health care that we're looking at in the future, it's going to change. It's going to change a lot. And I think pharmacists are going to play a big, big role in that.
Excellent. Thank you.
Thank you.
Congressman Buddy Carter, thank you so much for spending time with us here at the IPC booth and the McKesson IdeaShare. Being in Congress, being a leader, being a pharmacy owner, it's all part of care, and we need more people in Congress to do this. What do you say to pharmacists that are listening that could take that leap into politics and do more for the profession by being involved at your level?
Well, at my level is certainly important. Obviously, the federal level plays an important role, but the state level plays an important role. And if we look at what has been accomplished at the state level in the past few years, you'll see that we've accomplished quite a bit. I'm so proud, Arkansas. No PBM can be owned by a pharmacy.
Yep.
It is awesome. If you look at what happened with Rutledge and the Supreme Court ruling, all of that's good. We were a little disappointed in Oklahoma, but we kind of expected that. But at the same time, the initiatives that have been introduced and have been passed on the state level are numerous and are just fantastic. But the federal level is important, and we need to do more, and we're going to be doing more. When I say that you're going to see a lot of changes in healthcare in the near future, I'm not exaggerating. It's not just Secretary Kennedy, but it's just the mood, if you will, and the momentum that I see in Congress about, hey, we got to do something about healthcare costs. It's as I said earlier, fastest growing part of our budget, and we've got an aging population. We've got to get this under control.
Well, certainly we may have a pharmacy or an opening in Georgia 1 as we see hopefully have our largest advocate and friend in the United States Senate in the next round.
Well,
so
thank you.
Perhaps that will be the seat another pharmacist can fill for us as well.
Yeah, that'd be great. But we really do need a pharmacist in the Senate.
Absolutely.
And we're very excited about this. And the pharmacy community has embraced us and been very supportive, and we appreciate that very much.
Greg Reibold, Vice President of Healthcare Policy and General Counsel at APCI, joins the conversation next.
Pharmacy Podcast Network here at the IdeaShare, the McKesson IdeaShare. One of our new members is APCI, and they have dedicated resources to helping us expand the PBM Reform podcast that we launched way back in 2019. But what I was missing is someone who's constantly out there dialing into the specific state's progression of PBM reform, but then also having kind of a national overview of what's going on. So what I'm excited about is Greg Reibold from APCI is taking over that show, is now our host, and Greg is here with me today celebrating our get-together here in Nashville. How you doing, Greg?
Yeah, I'm doing really well. I appreciate you having me.
Absolutely. So what's this been like getting into podcasting? It's a little weird at first because I don't like the sound of my own voice still, and I've been doing it for 16 years.
You know, it's funny that might be the weirdest part is your own, because I'm not used to that either. But it's been great. Obviously, you've been beyond patient with me as I'm learning this stuff. But obviously, long time fan and listener of PBM Reform podcast. So it's very cool to get to hopefully take the mantle and keep it going. But we'll be doing right about once a month, but man, there's so much going on at the state level, so much going on at the federal level that it's almost like I've already got a backlog of things that I want to talk about and guests that I want to have.
Absolutely. And listen, if you're listening right now and your state's doing something that's progressive and forwarding, reach out to Greg and get on the show. If you have a relationship with a state senator, if you have a relationship with a congressperson, get them on the show, because we use this show to educate other policymakers. And when they get to listen to pharmacist stories and pharmacy owners and people that understand policy and you know how to speak the language, I think it really brings a lot more education in focus.
Couldn't agree more. And I think it's something that the podcast was doing already, but one of the goals will be to absolutely shape policy and shape policy conversations all over the country. And so it's a great platform to be able to do just that.
All right, bring us up to date. Bring our listeners up to date, some of the things that you've been working on.
Well, look, it's been an amazing year in a lot of states, right? So we've seen, and I'm not going to list them all, but we've seen really significant PBM reform. We've seen really significant reimbursement reform, fair reimbursement for independent pharmacy. We've been really active in that regard in a lot of states. There's a lot for independent pharmacy to be proud of. And then obviously, I think the one that's probably getting the most attention is what Arkansas did. And Arkansas did an amazing job. Had the privilege to be out there with them for a couple of days. And with what they did, essentially saying, hey, if you want to be a PBM in the state, you have to pick. You can't be a PBM and a pharmacy in the state of Arkansas. You're going to pick one. And so there's been just so many great things to work on. A lot of the states are wrapping up. We're focusing a lot on rulemaking now, implementation of the laws that are on the books, and that's so important, right? Because to me, I'd give pharmacy across the country, they've just had massive achievements over the last few years, legislatively, just pristine at the implementation level and the enforcement level. we're struggling in a lot of places. So there's a lot of work to do there, and we're focusing on that. And then, of course, things are really going to start, I think, ramping up federally with some big pieces of legislation, and we got to start getting some wins at the federal level.
Excellent, excellent. All right, so I think of the members that are part of your group. I'm thinking of members throughout the nation that have focuses and growing their business. PBM reform seems to be this piece of the business of pharmacy that's finally getting some momentum. What's your advice for listeners out there, for pharmacy owners out there that are tied in? How do you get more connection to your congresspeople? How often should we be reaching out to our Congress or senators to get them to tour the community pharmacy to really understand what the community pharmacy is doing?
Yeah, so I'm glad you asked that question. Community pharmacy has been more successful than almost any other industry in the last 5 years at state levels in advancing massive pieces of legislation. It is very hard to pass a bill, any bill, a non-controversial bill. And independent pharmacists have been the lifeblood of passing big legislation with immense opposition from some of the richest companies on earth, with literal armies of lobbyists. And the reason community pharmacy can do that is because of the grassroots relationships that they have. They are in Rotary clubs. They are caring for legislators' relatives. They're leaders in their church. They're leaders in their communities, right? And so those relationships are how we win in pharmacy. We need to keep that going. So most pharmacists have good relationships, particularly at the state level, but also at the federal level. But if you don't have that relationship, it's reaching out, it's introducing yourself, letting them know that you are there to be a resource for them, for any healthcare questions that they may have, and then absolutely inviting them to that pharmacy. Because I've been in some of those pharmacy visits, and it might sound cliche, but I have seen legislators who've gone in and literally they've walked out and they've been some of the biggest champions in their state and federal level for years and years and years. And that can start with one visit. One visit, and just take, letting them see what it is that pharmacists are having to do every single day, right? Behind the counter, caring for patients, running a business. And then when they start looking at those underwater reimbursements, when they start looking at those examples of steering, and it's not esoteric anymore. You can put it in their hand. These are my losses for the last 6 months. These are the patients that have been steered. And those folks walk out champions. We had in the Pharmacists Fight Back Act federal bill last year, we ended up getting 56 co-sponsors in under awesome. 6 months. And there was a U.S. congressperson, and it was, for all intents and purposes, going to be a no, I'm not signing on. And 3 pharmacists got together. They invited him into one of the pharmacies, and visit went great. He spent about 30 minutes in there. He went out to his car. He came back in and asked more questions. The next day, he signed on to Pharmacists Fight Back, right? It started with that pharmacy visit, and that guy wants to continue to work on very forward-looking, aggressive legislation that is going to keep his constituent pharmacist doors open. And they text him now, too. Sorry.
When a legislator gets to physically see what's happening behind the scenes, it opens up their mind and it makes them realize, I had no idea that patients need this, and what independent community pharmacy is doing for their communities, for their constituents, for their voters, that they can become educated so that they can finally be making voting decisions that truly are helping the community in this realm, and not keeping mail order as the only solution, or a major chain that keeps closing as the only solution. It's educating that our hometown pharmacies are the difference between no health care or some form of health care, some minimal form of health care.
That's right.
And being able to do more in point-of-care testing and anything else that can come out of it. But your leadership with the show is really important. And in just closing, tell our listeners just kind of like a piece of advice to round out for the rest of the year 2025.
Yeah, I think it's, at the state level, a lot of the work is done. Pay attention to implementation, pay attention to rulemaking, and at the federal level, be ready, right? Be ready to engage, because I think we're going to have action, and I think that this is going to be the time where we really can start to get some momentum. And I'd like to thank you also, Todd, just the platform that you've given pharmacy, not just independent pharmacy, but certainly particularly independent pharmacy, and the voice that you've given them to highlight these issues just has been amazing, and you just continue to be more and more prolific.
Well, thank you. And thank you for being part of the network and believing us and supporting us. We can't keep building these programs without your support, and it's been wonderful to work with you.
Awesome. Thank you so much.
Thank you.
Yep.
Success stories in independent community pharmacy are my favorite stories to tell, and we are here with Dr. Bishoy Gerges. He's CEO of St. Mary's Pharmacy. Welcome to the show, Bishoy.
Thank you, Todd. Thank you so much for having me. It's a pleasure.
Hey, so it's our infrastructure. It's McKesson, it's IPC, it's your pharmacy management system. It's all these systems that stand behind you, allowing you to not only be creative and clinical, serving your clients, and sometimes the most simple programs make the biggest impact. And a program that you were sharing with me about that I want you to kind of elaborate on to our listeners is the fact that you are able to move from a rebate system to a net pricing system, and it's really become a successful marker in your pharmacy business. Can you explain that to the listeners?
Yes, absolutely. So basically, one of the main important things that IPC is currently offered and moved away from, which is the rebate. Most pharmacies want to be able to purchase things at net price. You want to be able to see what you're getting the product for, and at the same time, you're reevaluating the reimbursements, that you're getting from the insurance plans. So it makes things a little bit more clear for you to be able to find your business. As a pharmacy owner, you want to see what is coming in and what's coming out. So it really just simplifies it and makes you understand a little bit more the financials of it, knowing exactly what to expect, and there is no surprises, down the line, financially speaking, for pharmacies. So it's made a great impact. Like I said, a lot of people want to see what the product will cost, and then based on that reimbursement, it just makes more sense.
Absolutely. So talk to me about your community. What's the demographics like? How many pharmacies are you representing, and are you growing? Talk to us a little bit about your business.
So I currently have 2 pharmacies based out of Los Angeles, California. We are definitely looking to expand into a third one, hopefully soon. I am involved in long-term care as well as retail. We do some specialty as well, and some 340B, so that's something that we're definitely starting to get into. There's a lot of opportunities that exist out there. It's just a matter of time, once you get there. One of the main things that we're definitely trying to dive into right now is the medication therapy management. That's a great niche to kind of get involved in. A lot of people, unfortunately, don't know what's out there and what exists, and I think it'll be, like I said, there are a lot of great opportunities that we as pharmacists need to be able to take advantage of. It's just, the resources are there. IPC definitely has a lot of these resources available. It's just a matter of reaching out, getting in contact with the right people to make sure that you're aware of those things that are available to you.
All right. So when I think of pharmacy ownership today, it's a different sea to be navigating, and a lot of storms with PBM reform and things that are happening. What other programs are you implementing that could be supported by IPC? It doesn't necessarily have to be, that you've seen connect with your community, something that they're not getting from like a major chain or something like that really personalizes medicine.
Well, we take pride as in knowing our patients. It's a very personalized relationship. Mm-hmm. I know most of my patients by name. I can guarantee you that at big chains, they don't have that type of relationship. Sometimes my patients and I will talk about where they're going to be going on vacation, and they know what's happening in my life, and I know what's happening in their life. That personalized experience, and our motto at our pharmacy, it's where we deliver personalized patient care. Mm-hmm. And we stand by that 100%, because I know what I have to offer. I hate to call it customer service because it's more patient care, but we are different. We have so much to offer. I know and I care for my patients. If something is going to harm my patient, I will do everything in my power to go above and beyond to make sure that that problem or issue is addressed, whether it's with their provider, make sure that the patient is aware of what's going on. So these are things that nobody else can offer compared to independent pharmacies. And I genuinely think that this is where healthcare should be at. It's not about just dispensing prescriptions, but actually caring for your patients.
Absolutely. So something that you, in your models, your business model is you have retail environment, you have your long-term care pharmacy environment. We're seeing a blending of those two because a lot of your patients that were 60 20 years ago, they're now 80, and they don't want to leave their home. They don't want to go to a nursing home. So talk to me about the evolution of retail community pharmacy being fused with long-term care and then delivering those services to the home.
So, we offer free delivery services to pretty much all of our patients. As I've had relationships with these patients, I've seen some of them deteriorate over the years, and obviously we have these services in place to make sure that they are still taken care of. There are some patients that I haven't seen for 5 years, but I still talk to them, on the phone. I don't expect everybody to come in. Everybody has certain circumstances. Some of them are disabled and they really need the extra help. Some of them are in facilities. So we understand that, we are able to deliver that service to them. I remember I used to go to patients' homes and even do some of their, before the bubble packaging and whatnot, I used to do their bill pack, for a week. And like I said, you won't have somebody at a big chain pharmacy do that.
Yeah.
And like I said, we take pride in being able to provide those services to our patients. And it makes me happy knowing that I can make a difference in somebody else's life, for sure.
What have you learned being part of a board of directors team, part of IPC, an organization that's owned by its members? What have you learned being part of this board?
I've learned a lot of things, for sure. One being that we can make a difference. We are the voice of the pharmacy profession. We are the voice of all these pharmacy owners. You have a great group of people, coming together with different backgrounds and different experiences, and being able to blend that all into one. It brings a whole different dynamic to the board. And like I said, one of the biggest things that we've been able to push and work with IPC is the governance issue with the legislation, and I think we're really making great progress, and we're hoping that with the PBM reforms and everything that are currently happening, the change will come. I feel like we've hit rock bottom, and it's eventually something that will, just push us to the next level and being able to move forward. So to everybody out there, I just want to make sure to tell you to stay optimistic, stay positive, because there are a lot of great things to come, and don't lose hope in the fact that this is not it. The reimbursement model, there's other reimbursement models, and there are other avenues and other things that we can definitely take advantage of, and just like I said, stay put, move forward, and just keep pushing.
For sure. This has been an awesome interview. I really appreciate your time here at IdeaShare 2025.
Thank you so much, Todd, for having me. I appreciate it.
Next up, we welcome Christopher Darling with Darling Apothecary.
Hey, I'm here with Chris Darling. He's the owner of Sprouts Drug Store in Shingle House, Pennsylvania. Do you know, I've never heard of Shingle House, Pennsylvania.
Most people haven't, to be honest with you, Todd. It's a small rural community in northwestern Pennsylvania. I think Olean, New York, or Bradford, Pennsylvania would be the closest communities.
All right, so you are a Steeler fan, or you're not a Steeler fan?
Go Bills.
Go Bills. Well, being a Pittsburgher, I'm a Steeler fan. So.
That's all right. I do. I actually enjoy the Steelers myself a bit too, but I'm a diehard Bills fan for life.
All right, Chris. So we're here at the McKesson IdeaShare. This has been a wonderful event. We've collected a ton of content and great interviews. What I'm excited to talk to you about is the national impact on public health with the closure of the Rite Aids. And in particular in Pennsylvania, they were headquartered in Pennsylvania, and lots of stores have closed throughout the state, affecting my own hometown of Brownsville, Pennsylvania. Brownsville Family Pharmacy closed about 6 months ago. None of that positioning with some of the high rises that have seniors in it. Is it really? No one's really backfilled it yet. And then the Rite Aid was not only an hour, a mile and a half away from that location. That is now closing. So my example of my hometown is happening all across the nation. It's happening, of course, where you're at. Talk to us about the impact that this has made on your particular business, and then a little bit of the insights of how we can get through this and grow.
Sure, absolutely. Thanks, Todd. So for our particular business, as I said, we're in Shingle House, Pennsylvania, a pharmacy that has been there since 1911, and really a heart of that community. Northwestern Pennsylvania is dotted with small communities: Coudersport, Smithport, Port Allegheny, a lot of little areas that a year ago we had 7 pharmacies. There were some acquisitions by Rite Aid of some of the pharmacies in the area over the last year, and then the ultimate closure of Rite Aid. It's the 2 Rite Aid locations that were the closest to us, creating really a vacuum and actually really bringing to light, I think, for Pennsylvania, some of the reimbursements issues with managed Medicaid, things along that. We had a 5x increase in volume basically overnight, and we really were not prepared. If we would have been given a month or 2, I think we could have been able to ramp up staff, ramp up everything, workstations, inventory, conversations with our primary wholesaler about maybe giving us a little bit of leeway on our increase in spend and cash flow and those type of things as an independent that all of a sudden become an issue. When your spending becomes 5x, you're truly waiting for those reimbursements to come back in for you. So, really, the Rite Aid closures, the verdict is still out whether it was a blessing or a curse for us. But I can tell you that one thing that it did was that week I was called by one of our state senators, one of our state representatives, the local commissioners of these communities, citizens. Really, it brought to light, really, I think, what's happening in not just Pennsylvania, but other states also, how we're seeing the community pharmacy disappear in these communities. And, communities without medical, without pharmacy, without education, those are communities that certainly suffer and really need those pieces to be critical. So we learned pretty quickly about some things we needed to upgrade. Our IVR system, our delivery, our registers, our staffing, really just things that had to happen quickly too, because people are patient to a level, right? And all of those people in those communities have been very kind to us. They understand that this wasn't something that we asked for to happen. But there's a lot to consider and a lot we're still learning to get better to serve that size of a volume increase for us.
So because of the expansion of business, have you started to think about where your next store should be positioned in order to pull in some of that business and sustain and support it?
Absolutely. We actually have in the process, we just got our state license for a pharmacy about 20 miles from our Sprouts location in one of the communities that was very proactive in reaching out to us and providing us resources to get that store started up, looking for real estate, looking for people that were interested in really finding ways for the community to be involved. And so, yes, we do have another location that we're hoping to get started up in that area. But the location would only make sense if wouldn't make sense if we didn't have maybe 340B opportunities or some other opportunities, long-term care that weren't just the standard retail prescriptions due to just reimbursements that really don't, they keep us viable, but barely.
Yep. So what cash-based businesses are fluid and making sense within your community service that you're doing? Are you doing immunizations? Are you doing diabetes management or whatever else you can dial into to get paid more?
Yeah, so certainly for us, immunizations is a big thing with flu season here coming up soon, clinics at different employers and really reaching out to those those areas where we feel we can help immunize. Long-term care has been a blessing for us, being able to help with some of the assisted livings and acquiring new business through those. The reimbursement model is a little bit more favorable, and that helps us too. But I also have, which has been really a great tie-in for me, I own a skilled home care agency. So back about in 2014, as we started to try to get beyond the counter to see what patients were really doing in their homes, I had a conversation with a woman and asked her about what are you seeing in the homes as a skilled nurse, as a PT, as an OT, and the stories weren't great. Medications put in multiple places, confusion with dosing, those type of things. So I really felt as pharmacy, it's hard for us. The patient, either it's delivered to their home or they show up at the counter. We have a brief interaction, but what happens after that? Yeah. So we opened up a skilled home agency, and it was a big haul. There's a lot that goes into it, and an even bigger investment than pharmacy, oddly enough, to get ourselves accredited and up and rolling. But now we provide physical therapy, occupational therapy, and medical social work, skilled nursing in 6 counties around us. So it's been enlightening. It's been rewarding to be able to make a difference and keep people in their homes. It's a different. I don't want to say it's a different feel, but when you have that intimacy of going into someone's home and seeing what is right and what is wrong, and working really hard to give them the resources to stay independent, it's a great feeling, and it's a great tie with pharmacy also, quite honestly.
Absolutely is. We worked with Happier at Home for 4 years to get their messaging out to pharmacies that wanted to bolt on home care services, and you're advanced. You were doing it in 2014. That's incredible. So that's a model that other pharmacy owners really need to look into, because there are pockets of the nation that don't have any services. They don't have long-term care facilities. They don't have skilled nursing facilities. The hospital is too far away, and the pharmacy sitting there with a grand opportunity.
Yeah, and it's great because one of the missions of our skilled home care is preventing hospital readmissions beyond just keeping independence. So it really is a perfect fit for us, because medication compliance and MedSync and those type of things that we talk about and have conversations about, remote patient monitoring. When you're talking about IPC and iCare Plus, they're working on those same things, and that continuity of care and that ability to service a patient beyond just the prescription is really what I see is the need we need to get to the future of pharmacy.
Absolutely. Chris, I really appreciate you spending time with us here at the McKesson IdeaShare. I appreciate it.
Yeah, thank you, Todd. I appreciate it too.
Cash-based business, being able to grow your independent community pharmacy through services that are profitable. I mean, goodness gracious, that's what we need. We need more of that. Integrative medicine, herbs out there, mushrooms out there. It's very confusing for the public. And when Dr. Google gets involved, who knows what they're going to find and what that credible source is. My credible source, my favorite source, is my favorite provider is the pharmacist. Chuck Schneider is here with me from LifeCykel. You have an amazing product that I experienced myself. There was an energy product that I think I drank that was the lion's mane, and how do you say that, Chuck?
Cordyceps.
Cordyceps. See, not a pharmacist. But welcome to the show. It's so good to see you.
Great to see you, Todd. Thank you for the chance to talk a little bit about the world of functional mushrooms.
Absolutely. So, like I said, I get a lot of people through Facebook, my family members. They always come to me thinking, hey, maybe Todd has the answer. I certainly don't. But I know enough to know that it's impacting people's lives. It's making people feel better. And I love the thought of combining pharmacological, traditional, pharmaceutical-driven medicines with the integrative, and allowing a pharmacist and a physician to dial into my needs, and then start supplementing other things. So talk to us about LifeCykel and the products and how exciting this has been.
Yeah. The mushrooms have been known for millennia for their therapeutic benefits. I mean, the Chinese and Japanese and even Hippocrates himself used mushrooms clinically. So they've been known, and what's happening in the space is really the science is advancing. So we have some great scientific evidence that support the use of functional mushrooms in various situations, health situations. So the market is booming. Now is a great time for independent pharmacies to tap into this growth, and it's being really fueled by that research, and it's also being benefited by the growth in the interest in natural products by consumers. So now is a great time. So for pharmacies that want to stay ahead of that curve, it's a great time to get involved with functional mushrooms.
When I think of pharmacists, the first word that comes to my mind is trust, because my physician's busy. He or she writes a prescription, gets it to my pharmacist is checking it out. All of a sudden they're like, wait a second, this is going to work for Todd because of an allergy or whatever's going on. So when I think of supplements, I also think of that word trust. Talk to me about the life cycle's quality and why pharmacy owners that are already engaged, why they love it so much.
Yeah, it's a very important aspect. The U.S. supplement market for mushrooms is $4 billion now, and it's going to be $8 billion by 2030. So there's tremendous growth. That said, there are a lot of companies that have flooded the marketplace, and quality is sometimes sacrificed because of that. So at LifeCykel, we've been in the business for 10 years, and we make a very high-quality product. We double extract our mushrooms that we grow in Wisconsin, and that double extraction pulls through all the beneficial nutrients that we want to have, but it also eliminates a lot of the starch or grains. Mushrooms are commonly grown on things like rice or oats. That's fine, but they need to be removed during extraction, and unfortunately some of the leading brands in this category contain a lot of starch, so consumers are not getting any therapeutic benefit. They're just wasting money on starch.
And they're wasting money because of the fad versus really integrating it into your life, not just as a fad, but something forever. And then talking to your pharmacist about things like allergies or what else you're doing, or are you a part-time athlete or whatever it is. And now you can talk to the life cycle team to figure out which of the products are best. So, let's do that. Let's, for the listener's sake, talk to me about, because I remember when you gave me a demo kit, I got 4 different products. So talk to us about those 4.
Yes, we make 6 different species of mushroom products. So anywhere from chaga and cordyceps to turkey tail and shiitake and lion's mane and reishi in between. So each one of those mushrooms is going to benefit our immune system. So regardless of which species you choose, they're going to help support our immune system. And coming out of COVID, immune system support is so heightened. But they all have unique properties. So our number one species is lion's mane, and lion's mane has been very well studied. If you take lion's mane, it helps with nerve growth factor in our brains, and it improves memory. So there's been a lot of interest in lion's mane in particular, but they all have their unique properties. The reishi is an adaptogenic mushroom. It works at GABA and 5-HTP to help regulate cortisol levels. So if it senses if our cortisol levels are up, it will lower them and help provide better sleep as a result.
That's incredible. All right. So I think we want to learn more. We've got to have you back on This Week in Pharmacy at some point. But Chuck, thank you so much for being part of the post show here at McKesson's IdeaShare 2025.
Thank you, Todd. I appreciate it.
This was part 1 of the McKesson IdeaShare post show. We hope you'll join us in the next episode featuring even more interviews from the event. And thanks for listening to the Pharmacy Podcast Network.